Hi, my name is Jennifer, and this is my physical assessment of the newborn. I'm going to introduce myself to the patient. Hi, baby Kumari. My name is Jennifer, and I'm going to look at you. You're not going to be happy about it. I am going to maintain her dignity and give her privacy. And then I'm going to talk to the mother. I want to know how she's eating, voiding, her sleep patterns are, and was she a full-term baby? Um, did she deliver vaginally or by C-section? And what was her APGAR score? So her APGAR score was 7 after 1 minute and then 9 after 5 minutes. So I'm going to then check the baby's vital signs. So I'm going to count her respirations for 1 minute, looking at the symmetry of her chest and making sure it's rising and falling, that she's not in any distress, that she has no nasal flaring or no trouble breathing. Her respirations are 36. Now I'm going to check her heart rate, and I'm listening to the rate, the rhythm, making sure I don't hear any murmurs for 1 minute. I would have worn my stethoscope before I put it on this baby's skin by just rubbing it on my hand. Okay, her heart rate is 136. I didn't hear any abnormalities. I'm going to check her axillary temperature. And that's 97.7. Then I want to measure the baby's length with a tape measure. She is 50.8 centimeters. I'm going to do her head circumference. Her head circumference is 34.8 centimeters. I'm going to do her chest circumference. Her chest circumference is 33 centimeters. And then I'm going to weigh her. Well, I'll weigh her with the diaper on, and then I can take it off when I'm done. But her weight is 4.54 kilograms. Okay, so I'm also looking at the general overall appearance of my baby while I'm doing this. I'm looking at her skin to see if she has any petechiae, any Mongolia spots, any lanugo, any myela, any in the vernix caseosa. And so then I will look at her face. I want to look at I'm noting the symmetry. Before I do that, I'm going to palpate her anterior and posterior fontanelles. So her anterior fontanelle should be diamond shaped. I'm noting when I look at both of them, any bulges, anything that's not normal, and the back posterior fontanelle should be a triangle shaped. I'm paying attention to the suture line and make sure I don't feel any lumps, noting any swelling on her head. I'm noting the color of the skin, make sure she doesn't have any of those red blotchy patches. And then I'm looking at her, again, the symmetry of her face. I'm looking at her eyes. I want to look at her iris. I want to check her on both of them. I'm going to check her iris, perla, the conjunctiva, make sure that that's white. If she has strabismus, and then I'm looking at her nose and make sure that it's not deviated. Again, she's breathing okay. I'm looking at her ears and making sure that they're symmetrical. Any abnormalities. I'm looking at her mouth. So I'm going to do the rooting. I'm going to stick my finger in her mouth and check her rooting reflex, sucking reflex, looking at her swallowing, seeing if she has any clefts, any white spots inside the mouth. I'm going to check well, this is the rooting reflex on both sides. I'm going to touch her cheek and see if she turns to that side. Touch the other cheek and see if she turns her face to that side. Babies don't have a neck. I'm going to look at, really have a neck that you can see. I'm going to look at her clavicles and make sure they're symmetrical. Any deviations. I'm looking at her nipples and making sure, seeing if there's any engorgement, which is normal from the mom's hormones. I'm gonna check her muscle tone. I'm gonna do check her reflexes. So I'm gonna do the tonic neck reflex. So I'll turn the baby's head to the side, and her arms should do like that. I'm going to turn her head to the other side, and her arms should do like that. And I'm going to check her moral reflex, and she should startle. Again, looking at the muscle tone. Then I'm going to check her belly, and her umbilicus, and make sure she has 2 arteries and 1 vein. And I'm going to listen to her bowel sounds. And I'm going to palpate the abdomen. Oh, I forgot. I'm also going to check her hand reflexes on each side. I'm looking at her fingers. I'm looking at her toes and make sure that she has all 5 fingers and toes. And I'll undo her diaper. I'm looking at her genitalia, making sure that this is a female, so that the labia is covering the clitoris, or if it was a male, the scrotum. I'm just paying attention to the testes and seeing, just feeling them, and looking at the rugae. And also with my baby, I can just, check her muscle tone and just stretch her to that side, stretch her to that side, move her legs. I'm going to check her Babinski reflex. And again, paying attention to muscle tone, the skin. I'm going to turn my baby over. Again, the skin, lanugo, Mongolia spots. I'm going to touch down the back of her to check out her spinal column. And I'm also going to check her Gallant, I think it's the Gallant reflex. And I'm going to look and make sure that she doesn't have any openings and that her anus is patent. And again, I'm going to note any like her crying, her behaviors. I'll ask the mom about the voiding patterns. She note any meconium that I see and ask mom about it, and ask mom about her sleeping patterns. And that is my assessment. Thank you for watching. Okay, so I also want to note that I forgot, when I'm listening to the heart, I'm going to naturally also be listening for the baby's breath sounds. I will say I'm not really sure the best place on the baby to listen for him, but I know when I'm listening to the heart, I should be able to hear her breath sounds. But I did mention her respirations. And again, thank you for watching my video.